Let's talk about the new nominee to be Surgeon General. Dr. Frita is a triple board certified nephrologist and the medical expert in internal medicine, pediatrics, and obesity medicine. Can we talk about Casey Means? Because Casey Means is being nominated by the Trump administration to become the Surgeon General of the United States.
She did not complete her residency. She is not currently licensed. She does not seem to have much clinical experience. She is a wellness influencer who has talked about some anti-vaccine rhetoric. She was sidestepping questions in that hearing. And quite frankly, she doesn't seem to be qualified by any stretch.
Right? And so I kind of just think about this world we're living in where it's tons of estrogens. It's not like there's a bunch of exogenous testosterones, right?
What is she talking about?
She doesn't know, neither do I. It frustrates me so much, especially since this administration is supposed to be all about meritocracy. But when you listen to her, what she is saying is not based in any type of evidence. She has no evidence. See, that's the key. When you are a board certified physician, when you have a medical license, you realize you can't just go around stating opinions because that's dangerous. People listen to you and then they might disregard what their actual physicians say.
Well, and the question from Bill Cassidy, who asked her, who is a physician himself.
But would you encourage mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die in this outbreak in South Carolina?
I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
Informed consent is going to be part of building trust in public health.
You seem very frustrated by her answer. Why is that?
I want to jump through the screen because no matter what, we always get informed consent. We always have to have the conversation, benefits, risks of vaccines, and you sign. Informed consent is there. She knows that. What he was asking her if she will encourage it. So I'm a doctor. I'm not a mechanic. If I go to get my car fixed, I don't want to sit there and have a conversation as if we're on the same level. I need the mechanic who's had the knowledge to encourage me to do what's best for my car. And that's the position we're in as physicians.
What's your concern about this particular person?
I'm afraid that the misinformation, disinformation will continue. And just as sure as we have an administration that's no longer recommending life-saving vaccines, people who are in income neighborhoods, people who don't have transportation to their doctors, people who don't have the time or the copay, they are going to be left unvaccinated, and people who are immunocompromised will pass away. And also, they need to not ever tell me anything about merits again. And they certainly don't need to mention DEI in a negative connotation, because she, just like RFK Jr., is wholly unqualified for this position.